Why are we talking about value today? Well, I know that every dentist on the planet is always wanting patients to say yes to treatment, right? Everybody wants more patients to say yes. We spend a lot of time trying to figure out how to get them to say yes or why they aren't saying yes. And presenting treatment is part of what we do every day in and day out. I'm hoping that this little short training that I do for you today is going to help you to think about value and the value that you provide to your patients just a little bit differently. And for most people, when they learn this, it really gets the creative juices flowing. So you may be, like me, exploding with new ideas when you learn all of this stuff today. And that's great. It gives you a great place to start. So before we dive into value and how you increase the value you provide to your patients, we're going to step back just a hair and talk about how I ended up down this rabbit hole, and how I learned these concepts, or why I guess I decided I needed to learn these things. I've been really frustrated with the commoditization of dentistry and actually a lot of healthcare ever since I've started practicing as an orthodontist. And the frustration, of course, is that oftentimes the public, our patients, think that all dentists are the same, that all dentistry care is the same, that they could simply just take the fee from one office and compare it to the fee from another office. And then if they're getting the same thing, it just comes down to price. And the problem with commoditization is that when dentistry is seen as a commodity, this race to the bottom starts to happen, because everyone feels like they have to have the lowest price. So what happens? We do things like discount treatment, we put coupons on treatment, time limited offers on treatment, and everyone is trying to be seen as the most affordable, the cheapest, whatever option in care, because they feel like patients only care about the cheapest price because we're all the same. And I don't love this idea of comparing apples to apples, because I know for a fact, I know foundationally that every dental office is not the same. The service provided, the care provided, the treatment provided is not the same across every dental office, or in my case, every orthodontic office. There are huge variations in what is provided office to office. And the only way that you can get that message across to your patients is to be different and be able to show them how you are different, so that they can't simply take a treatment plan from you and a treatment plan from the guy down the street and compare them, right? That's often what they're doing. When people are getting multiple opinions, they're price shopping, that's all they're doing. They don't know enough about the other stuff to be able to tell the difference between the two of you necessarily. So when this race to the bottom happens in commoditization, then it's a lose-lose. Everybody's losing in that game. So how do you win? How do you get out of the commoditization race? Well, you have to stand out from the crowd. You have to be different, and you have to be incomparable to anyone else that they would see. And then they will say yes to you, and you will start more treatment, and people will talk about you. And if they can't compare you, it is no longer apples to apples. All of a sudden, then they have a piece of paper from the other office, and they have a piece of paper from you, and they're comparing apples to mangoes, or apples to pina coladas. I don't know if we're talking fruit. They cannot compare them any longer. That's where you want to be. You want to be incomparable. Now, of course, there are many, many, many ways that you can stand out, where you can be different, how you can increase your case acceptance rate. There are many, many ways to do this, but we're going to talk about value today, because value is something that is easy to understand, and changes can be made quickly and easily to implement this. A lot of other things take your whole team and a lot more planning and work. So this is a great place to start. So when I went down this rabbit hole of trying to figure out how to differentiate myself in a market that has been commoditized largely, I found a great book called $100 Million Offers. And I've read a bazillion marketing books, but I really like this one because I like the way he describes value. And value is described as providing a desired outcome that is highly likely to be achieved with as little time delay, effort, and sacrifice on the part of the customer or patient as possible. So this means that anything that you can offer that will get your patient closer to their desired or dream outcome will add value. It also means that anything you can do to guarantee the chances that they will be successful or likely to achieve that desired outcome will increase value. It also means that if you can decrease the time delay of them getting to that dream outcome, you're increasing value. And if you can get their effort and sacrifice as low as possible to getting that desired outcome, you are also increasing perceived value. Why is this important? Well, the greater the value that you can provide, so use that equation, the greater the value that you can provide, the more likely your patient is to accept treatment, and the more value that you provide, it can be will be different and incomparable to an office that does not provide that value. So how do we figure out what things we can add to what we're already doing to increase the perceived value of what we're providing or increase the actual value of what we're providing to our patients? So perceived or actual, both of these work. You're gonna have to do some brainstorming here and some thinking, and you won't want to do this right now. You pause the video if you're watching this on replay, or do this later. But I want you to think about and then write down all things that work must be written down. All of your patients' biggest pain points. So what are their biggest pain points? What are their reasons for seeking out dental care? I also want you to write down all of their biggest objections. What are the reasons they say no to treatment or say maybe later to treatment? What could be the reasons behind their hesitation towards starting treatment? So you're going to have this big list of all of the pain points that your dental patient could possibly have and all of the reasons or objections that you commonly hear that come up around saying yes to treatment when you present treatment. And you're going to put as many on paper as possible. And this list is actually going to help you design and come up with what you can do to add value. I'm going to give you an example here because this really helps to solidify this for you. So let's say you have a patient who needs a crown. In the first scenario, I'll call it the typical dental office scenario, you explain to the patient why they need the crown, and you tell them that the fee, you or your financial coordinator or whoever presents treatment tells them that the fee for the crown is $1,000, let's say. Okay, that's very typical, and then the patient decides whether they do treatment or not. Let's give you another scenario. So let's say in this other scenario, you are doing something called value stacking, which is what we're talking about today. In this scenario, you present to the patient that they need the crown at your office, and you let them know that this also includes complimentary tooth whitening that they'll go home with today, as well as a guide to how to keep their teeth healthy for a lifetime, as an example. And this could be in print or digital format, or you could have it in both. And you also let them know that all of your crowns in the office are guaranteed for 5 years, and that the fee for this is $1,200. Now, thinking about those two scenarios, which scenario offers more value to the patient? I know this is a redundant question, but I want you to think about this. Which of these two scenarios are your patients more likely to say yes to? Which of the two scenarios are they more likely to talk about, maybe tell their friends and family about? And which of those two scenarios makes you more profitable? Well, if you were paying attention to numbers, in the first scenario I said $1,000, in the second scenario I said $1,200. Now some of you might be thinking, oh, but it depends how much that whitening costs, and then that digital product or whatever it is that you're giving them costs. Yes, that's part of it. But if more people say yes to treatment when you have your value stack, which is more profitable? I'm not suggesting you make things that are going to make your profit per case lower. Absolutely not. We're talking about things that you can create or provide that cost you less than what you were charging for them. But this should get your creative juices flowing for what you can provide to increase value. So how do we start breaking this down in your office? Well, you need to think about all of the procedures that you want patients to say yes to more often, and figure out how you can add value. So there are some more questions to consider. Is there a way for you to solve another problem or pain point that they might have at the same time? Is there a way for you to offer some type of guarantee or warranty? If you're going to do a guarantee, make sure you name it something awesome. Naming things is good. Can you overcome a common objection that you get around that particular procedure by giving them another service or maybe some type of informational product. You want to take that list that you created and all these ideas that are running in your head, and you want to try to come up with value stacks for your most common and or most profitable and any other procedure that you want more yeses on, and build them. Remember the equation from the beginning. You have to add things in that will make it more likely that they will get to their desired outcome with as little time, delay, effort, and sacrifice as possible. And you want to make it sound super achievable to them. So what this value stack does, the idea behind it, is to make this a no-brainer. It really won't make sense for them to go to another office or compare you to someone else when all that the other person is going to do is provide them with a crown. And you are going to provide them with all of these additional things. I know what some of you were thinking already. Back there, I said something about creating a guide. And some of you went, but I don't have time. I don't have time to like make things. I'm not creative. I don't want to have to write something or whatever. I get that. But I want you to consider that if you put some time and energy, and of course, get help in the places that you need help in creating some of these things, these are things that live on like forever, for the long term once you've created them. So they have a cost up front, but that's it. Then you get to use it forever and ever and ever. There are ways to get help with these things. So you might have someone super creative in your office. You may work with a marketing company or someone who helps you with social media or other things that might be able to help you with this. A resource that I use a lot is Fiverr, which is a freelancer site online where if you can get your copy completed, so the general words, what you want to teach, the part that you have the knowledge about that you want to put into a product for someone, you can get a designer on Fiverr super cheap to make you a really nice looking PDF or a super nice looking ebook or an infographic of some kind. There are many that you can get almost anything built. You can even get copywriting help on these sites if you really have all the general ideas and you want someone to make it sound really nice. Here's another free thing you can use, ChatGPT. If you've got the basics of what you want to say and you just need someone to make it sound more engaging, use better language, put it into an AI site and have them spit it out with better words. I use something called Jasper, which is just like ChatGPT. It's just something you pay for all the time to make my words sound better. So I want you to dig into this and figure out where are those places where you can add in this value. It's almost unlimited this is really only limited by your creativity. So the idea here, as a quick review, is you want to take the services you already provide and you want to make them more valuable and incomparable to any other office anywhere near you, if possible. I mean, it's possible that some people are doing this, but I guarantee you almost no one is doing this. I know that maybe sounds like a lot to some of you, but start small. Pick something easy. Like, I mean, I just gave you an example for crowns. If that makes sense to you, and go ahead and take it and use that. Create something that goes with something else. And make these little bundles. That's what I call a value stack. A little bundle where when they need something, they also get a whole bunch of other stuff with it. Think of the service that this is providing to your patient. Yes, this is going to help more people say yes to your treatment, which is amazing. Isn't that the ultimate goal? Don't we think that, well, we know we are great at what we do. We care about our patients deeply, and we want them to be successful in the treatment that we are providing to them. If there is a way that we can present treatment to them that will be more likely that they'll say yes to us, which means they get the best care from us instead of someone down the street, we should be doing that. We should be offering that. And when you increase this value, yes, they're going to say yes more often, but look at what else they get. They get, for example, a guide on how to keep their teeth healthy for their lifetime in written format that they get to keep forever and ever. That's amazing. That is incredible value for them. Don't underestimate things like that. There are information alone in a format that's easy for them to digest, that looks nice, is a fantastic way to provide extra value to your patients. Yes, extra services like whitening. I mean, think how cheap tooth whitening is that you could provide, or a bonus, and that might be something that's getting to their desired goal. All of these things are of benefit to your patient. This is not just for you. I would never ask you to do something that was just for you to get more dollars in your pocket. I don't operate that way. Anyone who knows me knows I don't operate that way. We're talking about getting the best possible care for your patient, which means coming to you, coming to see you and not somebody else. I love this idea. I love marketing so much. I love coming up with ways to package what you offer, to get your message across so that people understand the value of what you provide and how you are different and how it's worth their while to get treatment from you. I'm actually, like, I would call it knee deep, shin deep, I don't know, in the messes of this right now, because I'm building a marketing course just for women in dentistry that goes through not just this, but like a plethora of all of the magical things that work right now in marketing, lead magnets and funnels, and I mean, all the super cool stuff. And so if you are someone who loves marketing or is interested in doing better and different marketing than just your simple, like, basic informational ads that everybody's doing, make sure you send me a message and let me know, or type course in the comments down below. And as soon as this marketing course releases, I should have it finished this summer, I'll let you know, because I'm super excited about it. Marketing is one of my passions, and helping people to grow their practice and get their message out in the right way, I don't know, in an ethical way, is super duper important to me. And so that is one thing that I really love teaching. And of course, for any of you who don't know me or just landed in this group, I don't know, randomly because you came across something, I do have a program where I actually teach and coach women in dentistry. It's called the Dental Diva Method, on all sorts of things: leadership and mindset and team and culture and time management and increasing life's happiness and finding work-life balance and all of that good stuff. And all of the marketing things that I know and love are taught in that program as well. So if you're interested in that, you can always hit me up with a DM anytime. I'm happy to kind of tell you what's included in that program and all the fun stuff that we do in there. But I'll be here. I'm going to try to be on here every single week, giving you a short lesson or something that I think will be helpful to you in your practice, so that you can grow your practice and live that balanced life that you want. And I hope everyone has a wonderful weekend.